Well, first of all, thank you for coming.
No
It's been
problem.
great to know you for the last year and a half, I think, maybe.
Year and a half, I
Yeah.
believe.
Yeah.
It's been months.
No. We've been together for listen. We've known each other at least for a year and a half, maybe even
I
2 years.
believe.
I don't
Maybe
know.
I'm just forgetful.
Yeah. The first time I met you was when I was staying in Avida, right? That's the first time we met. I think it was like half a year after me
Yeah,
and Maria already been dating. 8 months after me and Maria been dating.
I think so.
Yeah, I think
Yeah.
before I
I
finished.
remember meeting you first in Trademark.
Yeah, 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 yeah.
I probably been to your place, but I've never met you yet. I think so. Or not. No, I don't think so.
I think you've been to Solinea when I was back in Israel.
Okay.
Right? You've been to Solinea Ayala?
Yeah, yeah, yeah,
Yeah,
yeah.
Maria told me
With
that you had
Maria.
difficulty to find the parking with the bike.
Yeah, yeah,
Right?
yeah.
Yeah. So, but the reason I brought you here, first of all, is because you're a great friend, and I always enjoy talking to you. The second reason is I well, my grandfather and my grandmother were both in the medical field. My grandfather was a medical doctor for 40 something years.
Amazing.
Yeah, yeah, yeah. Was one of the biggest doctors in Israel, actually. I mean, in his name wise, not in his richness, because he wasn't really working privately a lot, but publicly he was working a lot. He actually did. Like his whole thing was that he was the only doctor in Israel that did both cutting, what is it, body
Surgery.
parts? No,
Surgery.
cutting, like
Oh,
your hands, cutting your feet.
like when someone has diabetes, they have to cut it. That's what you mean,
right? Yeah, like that's why he was the only guy in Israel to cut, and also after to be able to how to say it, to rehabilitate.
Okay,
Yeah, so-
rehabilitate in like physical.
Exactly. Yeah, he was the only
Walking
one
and
that
all
can do
that.
both
Yeah.
in Israel. In all Israel, yeah, back in the days. So he's a really big name in the medical field. Like every time that I talk to a doctor and I say like Azaria, so they say like, "Wow, is your grandfather like Maurice Azaria?"
Yeah,
Yeah,
yeah.
everybody knows it. And my grandma also.
Famous guy.
Yeah. Wow. So
And your grandma?
and my grandma was also a nurse for
Ooh,
40 something
amazing.
years. They actually met in the hospital.
Perfect match.
Yeah, exactly. Exactly. The main nurse back in Israel in a lot of hospitals. Right? She's been a nurse for a
So
long
she's
time.
basically focused on where, like, on the floor or OR, ER.
It's a great question. I have no idea.
You, that's
Yeah.
fine.
Yeah.
Maybe it's different in the older ways.
No, I'm sure there is departments. I mean, they have to be, right? Because in the end of the day,
Yeah.
each nurse has.
But
different
what year
purposes.
was that?
She quit when she was in 2012. I think she went into pension. 2011.
It's interesting how in the medical field we have different practices in the past, and also recently, yeah, we have different practices.
Really?
Yeah.
So that's exactly what I wanted to talk to you about. I mean, for me at least, the most two interesting things about you is first of all the idea that you've been a nurse.
Yeah.
And you still do some sort of nursing. I mean, you're not practicing it, but
Right
you're
now,
learning nursing in
yes.
order to go to the US and be a nurse there.
Yes, soon I'll be taking my NCLEX.
Exactly.
But I've had experience in the operating room and the emergency room.
So that's really interesting for me. And the second thing that will be interesting to know is that you're trying to apply for a visa to the USA in order to move there.
Yeah.
Right now, I know, well, I mean, it's latest, for me, it's probably easier than for you, but I know how complex it is to even get a visa to the US, especially
It
now with
is.
Trump and everything.
Yes, especially now
Yeah.
that Trump is here.
So I want to know
He's
exactly-
making everything really hard for us.
For sure. He's really hating foreigners.
But that's how he does his ways. We can do nothing about that. But the
Exactly.
reason
He can
is
control
we
you.
have our own reasons. As Filipino nurses, why are there a lot of Filipino nurses traveling outside of the country?
So
That's what you guys want to know, right?
Exactly. Exactly. That's exactly
Yeah,
what I want
okay.
to know. Like, what is the thing with, because I've lived in the Philippines for the last 2 years, maybe even 2 years and a half, I think.
How was it?
I love the Philippines, obviously.
How was the experience in Philippines?
I love it.
Okay, that's
I
good.
love it, yeah.
That's a good thing.
Yeah, I love it. I really love it.
Yeah.
But I've never been to a hospital when I was injured. The only time that I've been to a hospital, like a real hospital, not just a private medical field, was when I had to make a surgery in my mouth because I had my gums were.
I
bleeding.
remember that. Yeah.
Yeah,
Maria
right.
told me.
Yeah, so I had to cut gum out of my upper gum and stitch it over here.
Yeah.
It was like 5-6 stitches. I couldn't talk for like 2 weeks.
How was the experience in the hospital?
So it was actually a really good hospital. I don't remember what was the name. Maybe you know.
Chonghua.
Maybe. You know, wait,
Perpetual.
maybe. You know when you go out of Ayala? So like
That's where I work. Perpetual. I believe it's Perpetual. It's like there's a small road going inside. Yeah, that's
exactly.
where I
Like
work.
the thing
Yeah.
like this, right? Because you have the main road and you have like a right turn.
Yeah.
One way, yeah. That one. Yeah. So there was a doctor there. She was she studied in Boston. So she's like a really high
Shout out to
doctor.
the doctor.
Shout out to the doctor. I forgot her name. Sorry, doctor. Great doctor. Ask someone where is a doctor from Boston. Anyway, so she did the surgery, and I haven't really encountered Filipino traditions of medical, but I've noticed even from the short time that I was there in perpetual for the 1 hour, 2 hours that I was there, that the practices are like 20 years older than what I know in Israel.
Yeah.
Right.
Okay, oh, I get that. Yeah, we're not
Anything.
really that advanced here compared to other countries.
Not only the medical field, also like the first of all the amount of staff. Second of all, the people that are there in the hospital. You can see they're really terminal sick and nobody's taking care of them. Like I've seen so many crazy things where like if that will happen in Israel, they will shut down the hospital after a week.
Really.
Right.
So
I'm trying to
basically,
understand. Besides corruption, of course we know corruption doesn't help all of this. Like it's the ultimate excuse, but the ultimate reason.
yeah.
But I want to understand exactly as a person who's been a nurse, what's the differences that you've seen or heard between nursing in the USA, for instance, where you want to move to, and the reason you want to move there compared to the Philippines?
So basically, I don't really have an experience on how they work their hospitals there, but of course they're more advanced because they're what do you call that? We're ranked 3, right, in third world country
Okay,
in the,
yeah.
the Philippines.
Yeah.
So of course there's gonna be a layback because I've experienced like even I don't want to lose my license, but like the the machines they use, most of it, like a lot of them are defective and all that, but then we still use it because we don't have that much resources compared to other countries. And also talking about the number of staffs, most nurses travel abroad because the money here is not giving at all. It's not enough to have your own family.
Okay.
Like if you're talking about paying for rent, paying for, would I be able to tell you how much my salary is as a
If
nurse?
you want to, for sure.
Yeah, I don't really mind because
I will be
I've
happy
been
to.
working for a year and my salary is sadly only 20K.
Okay.
Can
so
you imagine
for the-
that?
for
And
the
you
foreigners that are
imagine
watching-
how much rent is.
In case there is foreigners that are watching, 20K is $400.
I believe so.
Yeah, it's for 380.
Yeah.
So that's humiliating.
Mhm.
Nothing but humiliating. How many hours did you
'Cause-
used to work back then?
Supposedly, we're only gonna work for 8 to 9 hours,
A
but
day.
then
5 days a week
in
or 6 days a week?
cases, 5 days a week.
Okay.
In cases where there are like stat emergencies or like surgeries, because I work in the operating room, sometimes we get to have like a 16-hour, 15-hour shift.
And you still
Well,
get
it
paid
depends on the
20K.
cases, yeah.
Is there overtime or you just like go fuck yourself? That's the salary you get.
No, I mean like you don't have a choice. You have to do overtime because I
But you
work
get
in the
paid
operate.
overtime?
You do get paid, but I've actually asked about it, like how much is our overtime and all that, but nobody has ever answered me. I've asked the charge nurse, like it's not in the contract, nothing. Like I don't know. I'm working, I'm doing overtime, but I don't know how much I'm getting for it.
But if I understand correctly, Perpetual is a private
Yeah,
hospital.
yeah,
right?
yeah. It's run
Not
by
fully
nuns.
private, semi-private, or fully private.
I think it's semi-private.
Semi-private,
yeah.
right? Because it's some government.
But it's not public. It's not.
No, not public. I know. Yeah.
It is owned by like nuns.
By nuns.
Yeah,
No
like a
shit.
congregation of like all
Ah,
those.
like the organization.
Yeah, organization of like religious people.
Catholic.
Catholic. Yeah.
Catholic nuns.
Mm-hmm.
Okay. So it's owned by an organization of Catholic nuns, and I'm sure that the Catholic nuns have some sort of connection to the government, or they're a private entity as well.
I'm not so familiar about them having
Okay.
connections to the government, but I cannot call it a private hospital.
Okay, so it's semi-private.
Yeah, something like that.
And do you feel that the reason that the hospitals here, or well, I guess it's most of the hospitals, if Perpetual is semi-private, then I cannot even imagine how public hospitals are.
Yeah.
But do you think that the reason
exactly.
for it is simply because it's a third world country and the resources that you have are low? Or is there a lack of, I don't know if human integrity is the right word, but maybe the idea that they pay you so little makes the whole system shut down? Because the
I
second that the
believe
person
so.
who's operating
'Cause
doesn't want to be there, then how can the
Think
system
about
operate?
it. Philippines, we have a lot of resources. It's a good place to live in.
It is. It's
If
one of
you
the best.
compare it to
You have one of the
other
biggest
countries,
resources
because
in
you know,
Asia.
as you can hear in America, there's like shootings and all that crazy stuff, crazy people. I'm sorry for saying that, but I believe that's the truth, and that's what I see on social media.
That's
but
true.
I don't wanna say something unless I experience it. But based on my family members that work abroad, they do kind of get that some racism still, yeah. So I myself would want to stay in my country
Mm.
and just travel experience, but I don't think it's enough for me
It's
to
impossible.
yeah, to be successful and to like I don't think it's the end game, you know? I'm not done with my goals if I just stay as a nurse here. I don't think I'd be able to provide my child the best.
So
I have a daughter, so
my question is, do you think that the reason that the hospitals in the Philippines are so this active, right? Like they're really bad. I mean, you have to say it. Right? It's just how it is.
You said
Right?
it.
Yeah, it is. I mean, it is everything. You
I
can see it
believe
happening.
so. Yeah.
Even public transport here is better than hospitals because the public transport in
You
the
think
Philippines is
so?
pretty good.
I don't know. I don't use the public transport that much. Maybe now. I used to before, but it's not as accessible to everyone, especially who lives at very far places
Okay, yeah,
or
of
like
course, but
in
that's in
close
everywhere in the world.
places. So I don't know
Everywhere
how
in the
you can
world, if
say
you
it's
live apart,
better,
it's
yeah.
But what I'm asking is, why do you think is that? Okay, of course, the third world country, corruption, sure,
Mm-hmm.
that's the reason for everything. But what is the things that you see from the inside as a nurse that you say, okay, if A, B, C, D would have been fixed, I think that the public
So
hospitals.
basically, as a nurse or as a nursing student, we have certain practices we have to
Okay.
follow and all that. But when it comes to like in case to case basis where there are emergency happenings, we don't have all the resources. We're not. It's not complete. We have to find our ways.
Okay.
And for my experience as an OR nurse, I know I should only be focused on my job, but we still have other side jobs like bringing patients, carrying patients, and all that. Supposedly, that would be a task for the orderlies. I'm not saying I shouldn't do that because I myself, I like to get physical and I like to help out. But then, like dealing with papers, dealing with patients, and we still have to deal with all those carrying stuff. Even like, that's one thing I always complain about when I was working on the operating room. Sending specimens to the laboratory, and our laboratory is really,
Explain
really
exactly what
far.
you're saying. Exactly.
Like
Explain that.
specimens are when they have to take a part of a person's organs and stuff to get it biopsied or tested.
Okay.
So we have to put it in formalin and all those other stuff. Like we cannot focus on our jobs
So
because
the
we have
simple
other
process of
things to
sending the
do.
specimens to the laboratory takes a long
Yeah, it
time
takes a
on
long
its own.
time because like you've been to my hospital, right?
Right.
It's really big. It's really
huge.
yeah. From the operating room, which is in the new
It has like
building.
3 buildings, doesn't it? Like 4 or 5
Yeah.
parking, 3, 5 buildings.
I think the parking spot is like there's one parking spot for like all the staffs and all the patients, but there are like special parking spots for the doctors.
Okay.
Yeah, but the but then that's what I'm trying to say. Like, how can you focus giving good care to one patient when you're busy dealing with other stuff?
Right.
That's what I'm saying. Because we're so understaffed, we cannot focus our care on one person.
So that you say that the reason that there's so many people that are in the waiting rooms or that are in the hallway that are terminally sick because there are just not enough staff and not enough
Yeah,
resources to even take care of
understaffed.
them.
That's the main problem since before.
I gotta ask you something honestly.
Yeah.
Why do you think
sure.
anyone will want to work with 20K a month?
Exactly. Who would?
So why
I
do you?
mean, some people stay for a long time. I do because I have to have experience before traveling abroad. That's what they have. Some countries do ask for experience, so that's why.
Okay. So your plan was from the beginning to fly to the US. You just have to have some experience in the Philippines beforehand.
You guys know there are a lot of nurses in the Philippines, and most of them study so that they can go abroad.
Really?
Yeah.
So most of the reason that most of the nurses that are studying and working in the Philippines,
Yeah.
their goal in the end of the day is to be able to travel to Australia, Canada, US, Ireland in order to work there.
Basically, yeah.
Really?
Because you just asked me the question, who would want to work for
I know.
20K?
Yeah.
Doing
And even if
over
they're paying 50K, I mean,
overnight.
sure, it's not a lot, but 50K is something that you can actually live with.
Exactly. That
Yeah.
would be fine. That
Yeah.
would be really nice.
Yeah, because I'm sure you would like to stay in the Philippines. I don't think you want to move to the US.
And you know what's crazy? Call centers get paid more than nurses.
That's what
You
I'm
all you
saying.
have to do is sit and talk, like what I'm doing right now.
No,
I
that's
don't
what I'm
have to
saying.
carry patients. Yeah.
You're saving people's lives, and you get paid much lower. How much
Saving.
does MD get paid?
Huh?
How much does MD get paid?
MD?
Yeah.
Doctors, I think it would depend on their specialties. I think surgeons does get paid more, especially in like neurosurgeons. They don't have much cases,
Do you
but
know around how much?
I'm not really familiar.
Can you check for us, Philip? What is the average page of
What?
Maybe
the
I think you
average-
should base on the like general surgery.
Yeah, let's say
Oh,
average
no,
pay of a medical
general
doctor in the
doctor,
Philippines.
medical
How
doctor,
much?
yeah.
Yeah, average
For
pay.
general,
Medical doctor, average pay of a whole medical doctor. How much does a medical doctor average pay? Let's just keep talking while he's checking.
It's cool. Yeah. So I think the doctors, it would depend on how many cases they have, or if they're like a good known doctor, they would have more patients.
That's insane. That's
Yeah.
insane that they
in the Philippines, right?
yeah, the Philippines. Because back in Israel, I'll tell you how much I think is in Israel.
But I
what know.
believe that they have like ×3, ×5 more than we get.
So that's what I'm saying. You know, like my grandma, from what I remember, I think nurses today in Israel get paid around 300k peso, 350k peso. But you gotta remember that Israel is also a very
Yes.
very expensive country. I mean, 300k in the Philippines is like 300k in Israel. It's kind of like making 100k in the Philippines. Right?
Making 100K,
80K.
oh yeah.
It's good, but it's not like oh my god, you're
Mhm.
rich. Right here in the Philippines, you make 300k, you're rich. Back then in Israel, you make 300k, you're fine. You have a number?
50,000 pesos to 100.
No fucking way. Medical doctor.
50K.
Yeah.
Yeah, that's what I'm
50K to
saying.
100K.
I think you're talking
How
about
much is it in
family
Israel?
doctors.
Check it out. Israel
Israel?
compared to America. Compare Israel to the USA.
50K
Make
to
Israel
100K.
USA and let's say, I don't know, Britain, England.
Because like I've had experiences where I check the professional fee alone
Per month.
per month.
No. 50k a month. Keep going.
So I've had experiences where I saw the professional fee from some doctors, and like doing biopsy alone. Oh, I don't know if it's fine to share this,
But that's private doctors.
yeah, of course, private
Okay,
doctors.
Yeah, private
yeah.
doctor makes sense. Private doctor get charge how much they want, right?
25K for
Yeah.
one biopsy.
But that makes sense because they're private. They can do whatever they want.
Mm-hmm.
You don't want to go there.
Yeah, so you guys want to know about the general, general
right?
doctors,
Because if it's a
family
private, it's not fair,
doctors.
because there's private lawyers that are billionaires with a B because they charge
So
however they want.
here's an example for a family doctor where most people come to for checkups and all. Most of them get paid 500 for a checkup.
Peso.
Oh, for one
Okay.
patient, yeah.
Fuck.
So imagine like 8 patients a day.
In
You
Israel,
multiply.
it's 10,000 to $6,000 per month.
$6,000 to $10,000. Yeah.
Dollars.
So that's 300k to 550.
10,000 for
In,
Israel.
Israel.
In USA, it's 6,000, 16,000
Shit.
to $25,000
Wow.
per month.
So in the US, that's around
crazy.
like 700k. No, even 800k.
Mm-hmm.
Shit.
That's good.
Let's
Good.
study MD. What are we doing here?
What?
Let's study be a medical doctor. What the fuck we doing here?
Yeah.
I mean, you guys can study here as a doctor.
Yeah.
You pay less while
Yeah,
studying.
what are we doing
Get
here?
the-
Working as a podcast. What are we idiots? What's we doing?
Idiot.
Medical doctors. Holy shit. Nah, joking. It's 8
You're smart. You can be a doctor.
Oh, yeah, of course. I can do whatever I want. So, but from your experience, did you have any experience with medical doctors or nurses from abroad? Like, did you ever talk to them or see them in working? Did they give you guidance? Like, how exactly?
Well, I've had
Can you get closer to the microphone?
sorry.
Yeah, it's okay.
I've had like people, coworkers I worked with before, and now they're in abroad.
Hmm.
And yeah, they tell me things like their experience there versus here. They always say things positive there. It's way better there. That's what they say.
But the question is, do you feel? Of course, the pay is better. There's no questions about it. You just
Not
checked
the
it
pay
out.
alone, but like the working.
Of course, the research is the worse the better. No questions. About
Like they're not as stressed there as they are here.
That's not what I'm trying to understand. What I'm trying to understand is the quality of the human power.
Okay.
Right? Like, as a nurse in the Philippines, do you feel you have less knowledge or less abilities than a nurse in the USA?
I don't think so, cause like Filipinos are really good in like blending in. They easily learn. That's why
Okay.
you know how there's a lot of Filipinos working abroad,
Mm.
Filipino nurses working abroad.
Mm.
So most Filipinos are really fast learners, so that's not a problem to them.
Leave the
But-
fast learners. I'm not asking about the human power. I'm sure that the Filipinos are as capable as Americans.
Uh-huh.
I've lived in the Philippines, I know that. What I'm asking is that the
Capable as Americans.
Of course.
No, like if you talk about like the medical industry, I believe that like Filipinos are really hard workers. That's why.
You don't understand what I'm trying to say. I'll explain my question.
Mm-hmm.
What I'm asking is, the human power, as in the potential of human power in the Philippines, is the same or even better than the U.S. Right? I'm not comparing the
Human
humans.
power.
Yeah, the person. What I am asking is that is the knowledge that they teach you in a university in the Philippines or a nursing school in the Philippines is worse or different at least than the knowledge that they teach you back in the US? Are your practices older or only the research?
Currently, right now, I'm studying the NCLEX.
Right, well, that's
Yeah,
great. Okay.
so I can have a basis on their practices versus our practices. Yeah, so basically, we are taught the everything similar to them except for the laws. But the thing is, we don't practice everything here.
Explain.
So we have different other ways compared to their ways because they have a lot of resources, they have a lot of machines and all that. So that's why we're not as, how do you say that? We're not as advanced as they are.
Resource.
So yeah, we just become resourceful because we don't have everything they do.
I understand, but
Do
you say
you
that
get
the
what I mean?
knowledge
I don't know
itself-
how to say it.
The knowledge itself is the same.
Yeah, I think it's the same.
Okay. So the only difference is actually the resources that are
Mhm.
coming out. It's not really the people or the knowledge that they're getting.
Yeah, yeah. And if you think about it,
You have a question? Go.
What do you think about the AI is going to replace the doctors in the hospital?
if we replace the doctors in the hospital,
No, the AI. They think AI.
AI, that still needs a lot of like testing and all that. So I can't really like if you try to entrust a person's life on computer and all that.
Well, leave that alone. I mean, Fig's asking knowledgeable, not knowledge.
Knowledge.
Knowledge strictly. Like that's the knowledge.
Okay. So like as I'm studying, of course I will use Chat GPT
Right.
and AI. Sometimes, like especially when it comes to calculations, it's not always reliable.
Okay.
So yeah.
That's for
I did
sure.
check on-
It still hallucinates. But what he's trying to understand, I think, is do you think that there is some field in the medical field that AI will be able to replace in the next 5 years? Nurses, pharmacists, medical doctors, from your experience, from what you've seen.
Like not only with knowledge, also manpower.
Actual AI, a bot that will replace the doctor. Or at least decrease the
I
amount
believe
of
it's
doctors needed.
possible if they put more studies into it. I believe it's possible. Yeah.
Right.
Yeah.
I think so.
A robot doing laparoscopy.
Have you seen the Da Vinci machine?
Huh?
The Da Vinci machine?
No, what is
No?
that?
It's a machine that was, I think, 5 years ago or 6 years ago they invented it. I don't know if they have it already in hospitals, but I've seen a demo that they tried on it.
Mhm.
You know what Da Vinci was? The sculptor.
Yeah.
So, what it is like, it's a machine where there is a technician and there's a doctor in the room. So the technician controls the Da Vinci from afar. He just controls the joystick
Yeah,
like
yeah,
a game,
yeah.
like a PlayStation.
I get you.
And
Yeah.
the doctor tells him what to do. So
The
what they want
robot
to do is,
does
like,
it.
just two medical arms with a knife and like tools. You can switch tools like easily. Just
Yeah.
press the button you want. And the Da Vinci, they saw a video where you can literally take. Actually, just put it on the video. They will see it when the people look at the podcast. They can see it happening. They took the knife, like the smell, like the knife of
The scalpel,
the
yeah.
scalp, the scalp, and they took a small layer of a grape.
Yeah.
And the Da Vinci machine just took it out,
And it was really precise. That's what you mean.
precise in a way that no doctor can ever perform. Literal a fucking like this like paper thing you can taste through it thin
Yeah.
of a grape, and he just did it perfectly. Like he didn't
Yeah.
even make juice out of the grape. Like he didn't punch it.
No, it's always possible. We don't know. Like AI can do stuff, but being
And that's
in
not even AI, right?
Eh,
There's no AI in it. It's
we
an actual
had one
technician.
topic before why we always use paper because in other countries they use computers, they use tablets, yeah, and you see us, we still have all those charts
Yes,
and
I
all
see it.
that.
It's really weird.
So here in the Philippines we're not as advanced as they are, so whenever stuff happens, like shit happens and there's brownout or like the system messes up, because there are times where the computer crashes, yeah, and we have the paper, we at least we have the paper or the writings where it's still there, the information is still there. So that's why they try to avoid using the computer, because when shit happens they don't have all the datas and
There's
all.
no way in the world that's true.
Huh?
You're serious.
Yeah, we did have that topic, we did have that
You have to
sharing, that's
explain
why.
that further. Give me an example. That sounds crazy.
Sorry.
Just for the people that maybe didn't understand. But if I understand correctly, what you're saying is that the Philippines don't use computers on purpose, or at least in some cases on
Yeah,
purpose.
we
In
still
order
do
for if
use
there's a mess up,
computers.
then there's no
Yeah.
data for it.
Yeah,
you
no
have to give me an
data.
example.
We did not have like specific experiences because we still do use paper, but you know, like when instances happen where the electricity comes off and maybe the data won't be saved, so that's why they try to avoid that. They mentioned that to us
No, but
student nurses.
what I thought you said, maybe I didn't understand correctly.
But
is
you
that-
do get it, right? The thought that they're using paper
No,
over
so I'll tell you what
computer.
I thought. I thought you mean that, let's say right now there is a surgery and the surgery is messed up, like someone did something wrong. Then instead of writing it in the computer where someone can track it up, that will be written on paper and then nobody
Yeah,
can track it.
yeah. Most of our surgical notes are in paper.
Did you ever do something like a mistake or something?
In paper?
No, some just mistake like in a practice or
Surgery.
You've seen, doesn't matter. You, someone that you saw.
Me? My experience, medication error. I did that, and I had to file an incidents report. And you guys wanna know why? I was freaking exhausted. I didn't have sleep, and our schedules are crazy because from AM shift they put you to PM shift to AM shift. Like, think about your body clock. How can you adjust with that in like right away? You get me?
Yeah.
So that's what I'm saying. Understaffed plus they freaking drain their clients, their nurses a lot. Like, we're not robots. Maybe AI should take over.
Definitely, no?
Yeah.
But what would it
So
be like?
what's happened is the nurse from the AM, she sent me like what to do with this patient because I was in the recovery room where I have to take care of that patient. And I know it's not good to share personal stuff about patients, but I will share this, and I'm not mentioning any names and all that because they're really strict about,
It's okay.
So what happened is there was a doctor who prepared tramadol. Tramadol and oxycodone is different from tramadol. In tramadol, you need 1 ml.
Okay.
And then I was so exhausted because I was caring for like 4 other patients. And this one patient, she kept complaining about the pain, pain, pain. So I had to cater her right away. I was so exhausted that in my mind, I thought I was trying to instill tramadol because the doctor prepared tramadol here.
Right.
And then we only needed zero point 0.2 ml compared to 1 ml. 0.2 is so small.
Wow.
Yeah, and I gave it to the patient.
What happened?
I just noticed because her BP was rising up.
No, what happened to her?
And she's fine. She's fine.
Okay.
Actually, they say like I've told my friends in abroad. So, to be honest, like that dose in America is normal. Like why would they put you in detention for that or something? That's not a big trouble.
Okay.
So, yeah, but they have their own ways. Like she was okay, although her BP did rise up, and she said like, "What does this
What's BP?
medication make me feel groggy?"
What is BP?
Blood pressure,
Okay.
the blood pressure. But it was in normal range, so around 130. It wasn't really, really high up where everything was like, like fatal or something.
Right.
Everything was normal. But then I still had to write an incidents report for that because on the chart it said we only need 0.2, but I administered 1 ml.
But there was ever a case where you witnessed a doctor or a colleague or anyone that did a mistake, not something fatal, of course, but a mistake where the practice was not good enough, whether because of the exhaustion or whatever the reason is, and like the manager of the hospital or someone told you disappear it, like don't talk about it. It's just something that happened.
Oh, I've never had that
Put it under the
experience.
table.
No,
Okay.
no, I haven't. But of course, there are cases like that. But I don't really go
haven't
into other
experienced it.
people's. Yeah, with
Okay.
mine though, they really had to delve it out. One doctor was gonna like she she was in the anesthesia, and I told her, yo, this is what I've done, this and that. And then she said like, oh, let's do this, do that. But then they were still worried about the patient because the patient was still sleepy and groggy, so they couldn't bring them back to the floor. Because if we didn't have to bring them back to the floor after 2 hours, could have just went away with it. Because
But like nobody told you a story where you heard that kind of case where they told you put it under the table.
no,
Okay.
I haven't.
Okay. That's good. At least that.
Yeah.
At least.
Because I've also had an experience where it wasn't basically my fault, but I was the nurse, so I was. This is what they call the captain of the ship.
Okay.
So they always have to. Who is under that patient's care will always take the blame, even if you're not, if you didn't do the what do you call that, the wrong move.
Okay.
So for example, in a surgery, doctor should also be part of the blame whenever he makes a mistake. We also, yeah. If
Okay.
it's we're talking about legal stuff, legal matters. So that time, my experience, we were handling a patient having a chest tube,
Okay.
and that's critical because they had surgery where they put chest tubes in their
What is
chest.
the chest tube for?
Chest tube is when a patient has pneumothorax or there's
What is
water
pneumothorax?
buildup.
Okay.
Water buildup in the lungs.
Okay.
So they have a tube inserted here to drain the water so that
How does
the
that
lung
happen?
could expand properly. How does that happen? There are cases where patients have pneumonia or infections
Okay.
where their lungs build up a lot of water.
Okay.
Because in medical field, there's a lot of aspects to it. It's not only because of an infection. It could also be because of this, because of
course.
that. So, but that's not the main topic. I'm not gonna explain everything about that.
Just on one hand,
So,
I can really understand
what
what's going on.
happened is I was the nurse. I was on this side, and the elevator door isn't too big, right?
Right.
And then the orderly was on this right side. And for me, it was so unfair for me, but I cannot do anything. I had to take the blame. So he was on that side. He knew the chest tube bottle, the bottle for the all the secretions and all has to come through there. He pushed the cart right away, and the tube came off from the bottle. So we're like, ooh, so that's scary because it could create like tension pneumothorax or like it's not good. I don't want to explain the whole thing. But then it wasn't my fault because imagine I was here and the guy was the one pushing it. So I didn't see where the bottle is. He could have been cautious of when he pushed it. So he sees the bottle falling down or not. But the bottle came off. So I had to take the blame for that. You know what I mean? See, it's unfair. Like, we're so exhausted. And that time I had to do overtime too because there's a lot of cases and where there's only like 3 staffs.
Okay. So that's like you think that it sounds like the main reason that you think that the Philippines is such in shortage of good medical
Yeah,
care because of
everybody
exhausted
knows
lack of
that's
staff.
understaffed, yeah.
Okay.
And I don't know if the government does put money into the medical field because we do have a lot of taxes and all that.
Yeah.
But I don't think they're
Do you
bringing
see
justice
any,
to.
Do you see any corruption inside of the medical field? Like
Not
from
really.
the outside of the government, but from inside of the medical field?
For mine, no.
Like doctors that take money from the behind to get patients quicker?
No, I've not experienced it myself.
Okay.
No, but of course, there are other patients who want to give, to be thankful. You know, like a tip. But no, I don't really call that corruption.
No, it's not corruption.
No, I don't think so. I don't think so.
You say that the people that are in the medical field are good people that are really trying to help. It's just the government doesn't really help them to help.
I believe so, but the thing is, if you talk about people wanting to help, like I feel like they do originally want to help, but with all the exhaustion and like, do you want to help getting paid with 20K?
Right.
It's exhausting, especially if it's a day-to-day basis.
Right.
If you're not a hypocrite about it, of course it's exhausting. That's your job. You should love your job, of course. But if it doesn't bring you no justice, and if you don't think it's gonna help you escalate in life, why would you want to stay?
That's true. But
Even if you just want to help.
if that's the case, let's say right now, I mean, I don't want to be pessimistic here, but let's say right now you try to go to the US, and Trump really makes the procedures much more difficult, and it's impossible to go to the US. You just cannot. You have to stay in the Philippines. As a person who studied nursing, what do you think will be the next thing that you will try and go ahead and pursue in order to, I don't know, compensate for what you already did or try and make the money that you wish for? Or
This is a personal
what's the next
question,
step?
right? This is a me thing. This is a me question. So I myself, I'm not gonna lie, I'm a skillful person. So I can always do side jobs. I can do nails, I can do art, I draw and all that stuff. So I can do business too. My father's side, they do a lot of business, so I also learned some from it. But as Filipinos, like, not me, because I love my occupation. I like being a nurse.
Okay.
It's my choice, but others, they're actually forced to becoming a nurse because that's
Like
what like Filipino, like you gotta be a nurse, you gotta go abroad.
Generally Asian.
Generally, yeah.
Yeah.
So me, I love my job. I love surgery. I'm actually weird because as a kid, I'd be eating and watching surgery videos.
Really?
Yeah, I don't know. I actually really wanted to become a doctor, but so much time. Imagine if you do surgery, it's gonna take you 4 years for pre-med and another 4 years for medicine and then specializing and all that. So
That's really difficult.
exactly.
Okay. Okay. But let's say right now you look in the industry in the Philippines of nursing, or generally speaking of medical field. Let's say you'd say, I don't know, 10 years from now or 20 years from now. Do you think that the situation will de escalate, will be better? Or the situation will just stay exactly the same it is and
I
the
could
Philippines
never.
will never.
I could not tell
Okay.
because like right now the president, I don't know if he's putting. I don't really look into those things honestly. I don't make the
But
time.
did you see an improvement in when you were working as a medical nurse? Like, how many
No.
years did you work as a medical nurse?
I work for like a year.
A year.
A
One
year
year.
and yeah, 1 year plus.
Okay. And in that 1 year plus, did you see any differences for improvement?
No,
Nothing.
not at all.
Nothing.
Nothing. They actually, it's weird how they actually add up things that are not really important. Like, to our instance, like, because of the COVID thing, right?
Yeah.
They had to be strict about the hand washing and alcohol. Like, they were putting like alcohols on the end of patients' beds. Like you could literally just put it on the walls and all that. So they were doing it for improvement and all that, but I don't believe it was improving anything. So so far as 1 year, I don't think there was really good improvement
Right.
towards us,
Okay.
towards my field. I don't know about others. I don't know about the floor, but for 1 year, I've never really seen anything.
And how is the studying here as a nurse?
Studying
Yeah. How long do you need to study?
4 years as
4
a
years.
nurse. Yeah.
How is it to study?
Um, it depends on what school you are, but I studied at Cebu Doctors University for like 3 years and was really exhausting. You have to write down everything. Like what I told you, that's why we were like talking about charting and all that. But in UV, I've experienced for 1 year because I studied psych, because I failed psych. Yeah, I don't like psych. Yeah, dealing with crazy people when I'm crazy too. But yeah, that was different because in UV everything was simple. Everything was printed out. You just have to write the patient's names, information. But in CDU, you have to write everything from the DTRs, drug therapeutic records. Yeah. Studying is really exhausting. Before I had duties, I had to study. When it comes to like third year, fourth year, you barely get sleep. Like 3, 4 hours of sleep.
It's crazy. It's very difficult. But
It is.
Is the school itself provides with the right knowledge for you to actually practice as a nurse?
Yeah, CDU is a really good school.
Okay. Okay.
Yeah.
That's interesting. So you still like you say that's still the number one thing in order to improve the Philippines medical field.
What do I believe is the number one thing?
Yeah, salaries and understand.
Salaries, yeah. Because like, why would Filipinos travel abroad if they have enough money to, you know?
Right. So let's say right now, like in the medical field, we get $100, 100,000 K, 120K, or a nurse will get like
Dollars?
50. No, no. And the nurse will get like 50K, 60K. You said that a lot of Filipinos will want to become nurses because it's okay profession compared to the prices that you're getting.
Yeah, I
And
think
the profession itself
60K
is
would
really
be
fulfilling.
suffiable. Yeah,
Right.
yeah.
Do you have any idea where the money goes to, or how much money it goes in?
I don't know.
No.
I don't really think so. Like with the government and all, because
Yeah.
we're dealing with private. I was dealing with a private hospital, and
Semi-private.
yeah, yeah, yeah.
Yeah.
I'm not really familiar with
Okay.
that aspect
Okay,
yet.
okay. Yeah, that makes sense. So let's talk about the visa, the American visa.
Yeah.
Explain to us a bit about that. What exactly does it mean? How long does it take? What is the visa work? What is the changing since Trump went to be a president?
So, as of now, what I'm doing is I worked for a company called Shearwater, where they help me process my visas and also the exam, taking of the exam, which is the NCLEX exam. So they did most of the things, but I already started before because I wanted to do it by myself. But I think it would be safer if I work under a company because I'm studying same way I'm also getting paid. So I don't know much about the process of the visa, but I heard that it was harder now compared to before.
Okay.
Because
So what is
based on my cousins, they applied for a working visa.
Okay.
I don't think it was hard for them at that time.
And they're all in the US?
Yeah, most of them are in the U.S. Yeah.
Some of them are not because they didn't apply or because they didn't get the visa.
No, all of my cousins are nurses are in the U.S.
Okay.
Yeah.
Okay. So how long exactly does it take? Like let's say right now I'm a nurse. I've practiced 1 year in the Philippines.
I believe that you only need 1 to 2 years experience. It depends on the company in America.
So let's say I have 2 years of experience.
Yeah.
Right now I want to move to America. How long will it take from the moment that I made the decision till the moment I'm actually flying to the US?
Actually, it would depend on you because, like, when you want to take the NCLEX, saying you already passed the NCLEX, right?
Right.
And you plan. I'm not really familiar, but there was one company I spoke to. They said it would only take 6 months
6
till
months.
you can. Yeah.
So why you not do that?
Why didn't I do that?
Yeah.
Because I'm still taking my exam. I didn't pass yet.
Okay.
If you pass, then it will take 6 months and with the processing and
I
everything.
understand. Okay.
Yeah.
So the second you pass the NCLEX, you call it?
Yeah.
How many questions
When I pass, but me, I'm under a company, so I have to work for them for like 2 years, counting from
America?
when I started. Here.
Okay.
2 years. They're gonna process everything, like the visa and all.
Okay, so the company
No.
that pays for your visa, they pay for the studying, they
Yeah,
pay for
yeah,
everything, and you have to work for
yeah.
them for 2 years.
Yeah.
And only
And
then
they
you
have
can
like
fly.
partner companies in America where
Where they're gonna give you a job in the US.
yeah.
Okay, what's
They're
the pay?
also gonna the pay.
Yeah.
It's not. I don't know yet. They didn't send us
Around? Do you have
a
any
contract for the America, but
Do you have
here
any assumption?
assumption. If I base it on my cousin salary, where they're already specializing though,
Yeah.
it's like $60 an hour.
How much is it for a month? A year.
$60 if you multiply it like for a day.
It's 8 hours.
60 times 8, you get $480 in a day.
Times 21.
Times 21. $10,080.
Maybe we should let Motmot sponsor us.
10,000
Maybe we should let Motmot sponsor us. She's making
times
$11,000 a month.
pesos. 55.
Half a million pesos a
500,
month.
yeah.
She's making half a million pesos a month.
But you also have to consider the cost of living in America. It's
Motmot, you
not
want to be a
cheap.
sponsor? You call the podcast Motmot Podcast?
What podcast?
The Motmot Podcast.
Oh,
Sponsored
no,
by Motmot.
about that.
I'm joking.
I know you're joking. But
So,
yeah.
when exactly is going to be your NCLEX?
This December, first week of December.
Oh, shit.
Yeah,
Wow.
I'm scared.
That's very stressful.
Yeah, I've actually been studying, but I don't think it's enough.
Oh my
Like
God.
everything I know is enough. Like I don't know what questions are gonna come.
And God forbid you will fail. How long will it take for
Whoa,
the next one?
whoa, no way. I don't know. They still have to process the whole thing again. So maybe it's gonna take how many? July, August, September, October, November, December. 7 months.
7 months on the next one.
Yeah.
Oh shit.
Well, I believe it's like if it's faster because I already started and I don't need long study.
No.
So,
I'm saying,
so
let's
3
say
months,
right now-
maybe
let's
3
say-
months.
Okay.
Yeah.
So let's say you fail in December, you can try again in March.
Mm-hmm.
Okay, so that's not that bad.
Yeah, but I don't know. It depends because the company is the one scheduling the date of
Right.
exam. As long as you have ATT, I don't know if it's the same process as when you just started to take or when it's a retake.
Okay.
Yeah.
Okay. There's also one more thing I wanted to ask you about. Is it something that you feel comfortable or not? You tell
Sure.
me. As I've been here 2 years in the Philippines, I've met a lot of women. I've been with Maria for the last 2 years, but I've still talked to a lot of women, right? I haven't had anything with them, but
Okay.
and so many women that I meet around in the Philippines are single mothers. I think it's the biggest number of single mothers I've seen in my life.
Really?
Every woman that I met is a single mother in some way or sort.
Mad.
I want to ask you, as a single mother yourself, you're a single mother.
Yeah, I'm a single mother because I choose
Why?
not to be married.
How is it and why?
Sorry,
Like, why?
but I don't want to say that. So
And I'm sure you have a lot of friends that are also
you know
single.
what's crazy?
Even Maria. Yeah.
You know what's crazy? Filipina mothers are actually really strict.
What do you
They're
mean?
really conservative compared to other countries. Because maybe I think it's because abortion is illegal here. You don't get the freedom to choose.
You think that's the reason there's so many
I
single
believe
mothers?
so, yeah.
Because even the
That's
husband
that's
is
part of it.
even the husband is bad, you cannot abort the
'Cause-
baby.
Hmm?
Even if the boyfriend is bad, you cannot abort the baby. So there's
No,
a lot
you
of single
can't.
mothers.
No, you can't.
No, I know you can. That's what I'm saying. You think that's the reason that there is a lot of single
Yeah.
mothers? Okay. Okay. And how is it?
Do you want to know the illegal part? No.
What do you mean?
I mean, of course, some people still get
Of course.
connections.
Of
Yeah.
course. Of course, it's still possible. Yeah. How is it to be a single mother though? What do you? I mean, it's
Bro,
a
it's
real question
stressful.
because you don't know
Well,
how it
I've-
is not to be. What?
Imagine if I didn't have the help of my parents, it would be really a struggle, especially with my salary.
Yeah.
I don't think I'd be able to survive.
What's the name of your daughter again?
AV.
Avi. She's
Aviana
5 this
Janae Lawson.
next week, right?
Yeah.
Right. How much money do you think you're spending on Avi a month?
Without the help of my parents, if
Let's
ever. If ever.
Yeah.
I think like with milk alone, it's like 4K. She doesn't eat that much. She only drinks milk, and like one bag divided by 4K, 1,000 for like a week.
You needed to get closer to the microphone. Louder. Can you
Oh,
speak a bit louder?
1K for like a week for milk alone.
Wow.
Yeah.
So like 4K a month. That's
Yeah,
only
yeah,
food.
yeah.
Shit. So that's 10K minimum.
Mhm. That's for the milk alone, like diapers and all that diapers. Avi doesn't wear diaper all the time, only when she sleeps. Cause not
Right,
that
so
she
where's the
bedwets, yeah, but
Yeah.
still just being cautious. She's gonna be trained about it soon. But yeah, diaper is like 300 for like 24
I
pieces.
don't need to know every number,
Yeah.
but it's around like
No,
10K.
think about it. Yeah, for the.
Really can't.
No, 'cause I
like
don't-
yesterday I bought her a fruit that was like 5 pesos. So but it's
So
around like 10K, 50K a
basically,
month.
the most important ones like the milk, the vitamins,
Yeah.
and all that. I think for a month it's like 15K.
And let's say if ever you didn't have the help of your parents, do you think it would be possible to like make her a normal human being without taking loans upon loans to feed her?
I've never um I think it is possible if we do live a really
How?
poor simple life.
How with 20K? How?
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 If we're not renting, if we do have a place, it's still under my parents. So
No,
it's
okay,
really
that's
hard.
it. Because a lot of people, a lot of Filipinos that I know of, are not only not being helped by their parents, the opposite. The parents are being helped upon them.
Yeah,
The
right?
Parents, right? A lot.
They're the ones helping their
Right?
parents,
So
yeah.
that's what I'm thinking. Like, okay, let's say I'm a Filipino. I make 20K a month, for instance. My
Mm-hmm.
parents need my help and I have a kid.
Yeah, I don't know how they do that. Like I could not, and I'm the type of person who does not like to borrow money. Like my whole life, I've never like took loans for that, except for like buying a phone. That's
Okay.
the only loan I've tried.
So you don't know exactly how does that feel or what is it?
Yeah, I
Okay.
know. I can't. I'm just so thankful for my
Do you
family
have
for
friends
helping
that
me
does
out.
those things that have like single parents that always have to take loans upon loans and leave utang to utang?
Yeah, I do.
Yeah?
Yeah,
Wow.
Maria too.
Maria has been like that, right? Before.
No. I mean, like she has
She
a
has
friend.
friends.
Like
Yeah,
we
yeah.
have mutual friends.
Yeah. And because she didn't, because her parents also help her out. Yeah, she has great friends.
Yeah.
That's insane.
And yeah, and that situation where they also have to help their parents. They have their own kid, and they also have to help their parents.
Right now, you're working right now as a VA, right?
Yeah, it's support actually support, but they give us a study period where we only have to focus on our studies before the exam.
Okay. That's from the company as well. Right.
They're a really good company.
Do you see any way of the Filipinos to get out of the Filipino prison of living from loan to loan? Because there's no choice when you make only 25, 30K.
Do I think it's possible?
Yeah. Without moving abroad.
No.
No?
No, it's really hard. Like experiencing like being a mom and doing groceries, bruh. Grocery for a day. You don't even get to buy meat and all that. Already spent like 2K for snacks alone. Yeah.
It's crazy. Can you even
Imagine
imagine
that.
living that way?
A lot.
Huh?
A lot of.
It's impossible.
Yeah.
I don't wanna talk about my finances. Doesn't matter how much I
Yeah,
make.
yeah.
Doesn't matter how much I make. But I spend here a month with Maria because I'm spending also for her at least 100K a month,
Mm-hmm.
right? Like
100K a
yeah,
month.
my rent alone is 30K. So like,
Imagine 20K.
so that's what I'm saying. You know, like I live great.
That's
I'm not
good.
complaining at all. I have a great apartment. I have an office as an apartment. I mean, this office is 25K a month, and I work this and my apartment. I'm not complaining. But I'm saying like even if when I made back in the day when I was working in the cosmetics, I was making 30K a month, right? That was my salaries back then, and I was spending like 20K. I I felt every day like there is a fucking huge
Stone.
over my head that I just have to carry day after day after day after
Yeah.
day. It's the most stressful period I had in my life.
Mhm.
You don't sleep, you don't eat, you don't do anything. Everything that you do is only considered about how to make more money.
Mhm.
It's insane. Because I cannot take loans, of course, as a foreigner here in the Philippines. I have to get into debt in Israel in order to cover up my expenses. Because in Israel we have overdraft, so I went into huge overdraft,
Yeah.
like 300K overdraft, in order to supply what I have here.
Mhm.
Leave alone that I brought everything back with Etsy dropshipping and everything that I'm doing right now. I'm in a much better place because of the skills that I acquired. But
That's good.
yeah, but simply the idea of living that way. I mean, as a Filipino, you haven't experienced it personally because you said that
Yeah.
your parents helped you. But in the end of the day, I'm sure you are familiar and can explain to me much better than I don't know someone else. How exactly does it feel, or how does it like what your friends are describing you, or how I'm trying to understand this feeling because for me,
I
one
don't
year I
know
wanted to kill
about
myself.
the friends, but the thing is, they do borrow money from me because I do have a job.
Really?
Yeah,
From
but
you?
then I don't know how their experience is. But they do tell me like, yo, it's really hard for them. They do cry all the time and all that. And then they still have to help their parents with stuff. So I don't know what goes on to their life when they're caring for the child and caring for parents, having the really small salary here in the Philippines. But they keep borrowing from different other people because I myself get like I don't like borrowing from people because it stresses me out. Yo, I have to
It
pay
is
this guy. I have to
stressful.
pay this guy.
Yeah.
Yeah, I don't know how they experienced because after that they ghosted me. They ghosted me and they still owe me money, but at least I was able to help. But yeah, it's really hard. You can see like documentaries, Filipinos living in the provinces and all that. They don't spend as much as people here in the
Of course.
city, but they be struggling too.
It's insane.
Yeah. And you can't like living with a small salary, I don't think you can afford to be healthy.
Yeah.
Yeah, because
You have to eat corn
pancit
rice.
canton is cheap. It's really cheap
Say again, say
compared to
again.
buying a lettuce and all
Say
that.
again, what do you call it?
Pancit
What is
canton.
pancit canton?
Pancit canton. Haven't you tried pancit
No.
canton?
What is pancit canton?
Oh my gosh, it's like Indomie. You know Indomie?
No.
What else? Cheap version of it's like a ramen. It's like a small ramen.
It's like the quick soup.
No, no, wait. What do you call ramyun? Ba ramyun. You know the like the really spicy ramen where people does challenge and all.
I don't know what it is.
You want me to show you?
Sure.
Okay.
I'm gonna
Maria,
put-
why don't you tell him what pancit canton is? What the heck?
You know what's pancit canton?
Huh?
Do you know what's pancit canton?
What is it?
I don't know.
This
Okay.
one.
Ah.
Show me.
Show to the camera. Show to the camera.
Yeah. Don't show the food. Show the packet, the green
Yeah,
packet.
show the camera.
That's
Show the go to
pancit
images and show the
canton.
camera.
This one?
Go to images. Go to
Yeah,
images.
the green one. Yeah. The one piece is like 7 pesos, and
Okay, so that's what they eat.
yeah,
Okay.
7 or 12 now. Before it was 7, I believe.
And does that feel it?
Hmm? How
Feel
much
it.
is it?
Okay.
Pancit canton.
36. It's 80 grams. Maybe there's as many.
Lame?
It's okay, but I don't think it's good for like all the time.
No.
Yeah, it's really unhealthy. They say it can
I
cause
thought the food that
cancer.
the people who don't have a lot of money is corn rice, right? Because you don't have money for white rice, you eat corn rice.
Yeah, corn rice too.
Yeah.
And mais is actually we call it mais.
Mais?
Yeah, corn. Corn is mais in
Mm.
Bisaya, Tagalog.
Okay.
Yeah, that's what they eat in provinces. Actually, I like it.
Yeah, it's tasty. I've never tried.
Mm-hmm.
You said that you make Nigerian food, right? Maybe you
Hey, can we not mention Nigerian here?
Huh?
Can we not mention Nigerian?
What?
Okay. Yes, I like making food.
Yeah.
Not only Nigerian food.
What else?
I make Filipino food like adobo,
Yeah. Chicken adobo?
humba, Bicol Express,
Really?
dinoldog. Yeah,
You
I
should
know how
cook
to
for us,
make
no?
hummus too. It's easy.
You should cook for us.
Sure,
Yeah.
but I'm gonna cook Nigerian food though.
I pay for the ingredients. I'll pay you.
Okay, let's go. Let's make coconut rice.
You should.
Are you allergic to shrimp?
No.
Good.
I need to be that.
Only guys, don't listen to that.
Don't listen to
guys.
it.
It's not good.
Not listen to
So
So, Motmot,
I
are you
think
excited? Are you excited to go to the
you,
US?
you had a question like which one was my most which is the worst duty I've had, right?
Let's go.
You've asked
That's
me
a good
that.
question, yeah.
So before I've had a craniotomy case.
Explain to us what does it mean. We're not medical.
Craniotomy is a surgery for the brain.
You said that you had your worst case was when you had a brain surgery to do to someone.
So I don't really call it like the worst case because of craniotomy. It's because we were understaffed that time, and I was
Like even more than usual.
yeah, I was it was a stat craniotomy, so it was a random. We have to prepare right away and all that. We weren't able to prepare beforehand because it was a stat, and I was at night shift that time, so I was really exhausted. Imagine waking up at night and then working and all that.
How many hours
And
did you
in
sleep
the
in that night?
morning,
How many hours did you sleep in that night?
in that night, I was awake the whole time because it was
You didn't
a
sleep.
stat surgery.
How long were you awake for?
I was asleep in the morning, but I barely had sleep because in the morning I cannot sleep properly. I think I only had like 3-4 hours of sleep and then had to go to duty.
So how many hours? Like 36, 48 hours? How long?
3 to 4, 3 to 4 hours sleep.
No, I understand. But how many hours were you awake, like in total? Like till the time you actually got some sleep?
Oh,
Like
that
normal
duty that duty lasted for 16 hours.
Shit.
Yeah, I had
And then 3
craniotomy
hours
the
sleep
whole
and then
night.
another 16 hours?
I believe that they put me in because I am off the next day. But if
Wow.
the off is like you don't feel like you had an off because
you're
the
just
following
sleeping all
day you were gonna be AM or PM shift. Because usually if you're off, they put you in an AM or PM shift from night shift. So I had craniotomy, right? And then luckily I believe I remember if I can remember the surgery lasted for 9 hours.
Okay.
And I was like, sheesh, I can go home. I'm good. The papers are all good and all that. Then, boom, another stat case comes in. And all the morning staffs have all their own cases. So I had to take the case. I had to take an overnight. I mean, like, what do you call that? Overtime shift. So
What was the next step? What was the next?
the next case was stat appendectomy because usually
Explain.
appendectomy is stat cases because
Explain.
when appendectomy is when they have to remove their appendix because it might rupture and it can cause like problems
Shit.
to your system.
That
So
sounds
it was a
difficult
stat
surgery.
case. Not really, but it depends on how the no the appendix if it's really
Ah.
bad if it's about to rupture. If it's ruptured, then it would probably really be a long case because no some people die of
Because they need to clean everything up.
yeah. So luckily it wasn't really, but then I still had to stay for how many more hours like because I still have to do aftercare after
Iman,
and then
I have to ask you a question.
what.
Besides the fact that it's very inconvenient and not comfortable and
That was the worst though, but we
Yeah,
always have a lot of those experiences.
no, I understand. That's what I'm trying to ask. I'm sure that's not the first time, and I'm sure that's not gonna be the last time, and I'm sure that's shit. But what I'm trying to really understand is, and that's a difficult question to answer because you don't want to answer it
What?
probably honestly. But do you feel like, I mean, okay, I'll give you an example from my own line of work.
Okay.
When I'm exhausted, let's say I have a day where I work 16 hours, 18 hours because I have a lot of clients calling me and I need to take care of a lot of stuff when there's many things to do because everything is urgent. Because also in business, a lot of things can be really urgent. If I keep working the day tomorrow and don't get enough sleep, all of my day is fucked. Like all of my clients are fucked, all of my calls are fucked, my sales calls are looks like shit, everything is bad.
Yeah.
Right? Everything doesn't work well.
Yeah.
I'm business. So worst case scenario, my client doesn't come out happy, I make less money, oh my god, like nothing happened.
Mm-hmm.
You're talking about human lives here.
Yeah.
Literally
We are.
human lives. Like
Yeah,
you're
but
taking
then-
a guy appendix out.
It's
you're
not like
fixing a guy's
business.
brain.
It's not like business where you can cut off agreement with that certain person because
Exactly.
you're not
Like,
happy
it's also
about.
no,
Yeah.
but also in your case, it's a one-time thing. Let's say I fuck up a customer, I call in the next day tomorrow, I can fix it. You fuck up a
Mhm.
patient, he's dead,
Yeah.
or at least
I don't
much.
think
Yeah.
to the part where it's fatal, but even if you can't get like quality care
Of
to
course.
that certain patient, you will
Maybe
still
not
be
that, but still
in your
something,
job
yeah.
unless it was something where it caused death or something like
Yeah,
that.
but yours to the extreme. Like
Yeah,
yours,
yeah, yeah. Because
everything.
we're dealing with life. Life is different.
Exactly.
Yeah.
Right. So what I'm asking is, besides the fact that it's very inconvenient, sometimes where you're thinking like, I'm not supposed to do this right now with this amount of hours of sleep because I'm gonna fuck this up.
Yeah.
I'm not gonna be able to.
I
perform.
told you my experience, right, where I gave the wrong amount
And you
of
think that will help?
medication
Okay.
because I was so exhausted. I swear to God, like you are telling me things, but you think everything would come in my head when I'm like dealing with that other patient screaming, "Oh, I'm in pain, I'm in pain," and you're still telling me, "Yo, this give this to this patient." It's exhausting. It's really exhausting.
Did you ever feel like if I'm gonna do this patient right now, I'm gonna make a mistake for 100% because I'm just not ready for
No,
this?
you're out of your head.
You're out
You
of your
don't.
head. You
You
have no
think you're
choice.
just no.
Okay, you're like a robot.
I'm not like a robot. I get really exhausted, but I have to fight through because I have no other options. There isn't no other staff who could help me because they also have their own shit to deal with. Sorry.
It's okay, you can curse.
Yeah.
Yeah,
Yeah.
that's crazy. That's scary.
That is
That scares
scary.
me out.
And you know, sometimes where I get so exhausted from night shift and I have to drive going home and have to drive my bike, sometimes I
And
get
very
really
easy
sleepy
you can fall
driving.
asleep.
Yeah. I almost did, but luckily I'm alive. I've
That
never
really
been into accidents and all that.
That's scary for you, but what I'm saying as a person who who will need to go one day or send his parents one day to hospitals, I cannot even imagine a case where my parents or me are in a fatal case or even something that is something important and the person that is
Yeah.
operating on me is tired.
Mm-hmm.
That's so scary
Exactly.
because it's a one wrong movement of the knife can change my whole life forever.
Mm-hmm.
Make me handicapped, make me crippled.
I don't think I've had experience where because of nurses' exhaustion we lost a life based on my experience.
Okay.
Because in the operating room we have
But I'm sure also the
anesthesiologists and
doctors
all.
are working like assholes, don't they?
Yeah.
Right?
Imagine.
I'm sure also the
Not gonna
operators
lie.
are working like shit.
But I actually have videos and all that where like the doctors they're like helping not the professional doctors because they can always choose their own schedules, but the
The general MD.
resident doctors where they're not yet
Ah,
what
like
do you
kind of
call
an
that?
interns.
Yeah,
Okay.
like quite like interns, but
Beginners,
not
yeah.
interns. Yeah, so they help with the surgery where they have to
Open.
open. Yeah, help open. Some of them they be doing this and then falling
Wow.
down already. I do have videos. A lot of them they're very stressed out. They have to deal with many patients. A lot of patients plus us. You have to call them like, "Yo, doc, what are we gonna do? The patient is complaining this and that," and I am like, so their job is really hard.
That's so scary.
Yeah, because consultants, they're like the top doctors, and then them, which are the residents. We all go to the residents. The residents have to go to the consultants.
Do you have any experience with non-semi-private hospitals? Like, do you have any experience with actual private hospitals? No.
No, I believe I don't. I've only tried perpetual.
And do you have any experience with public ones? No.
No,
Do you have a
but
friend?
when I was a student, I did try public ones,
is
and
it
it's
public?
really brutal.
It's worse.
It's crazy.
Why?
Like they don't even follow like talking about therapeutic communications. No, they don't do that shit.
Fucking shit.
Like literally, when a patient comes in the delivery room saying, I'm in pain. Fuck this." It's not our fault. You make another child. That's what they are. Yeah, for real. And then there was this
It's like
one
the guard-
patient. I
it's
feel
like the
like
guard
she had a
who racist.
miscarriage. She had a miscarriage, right? And she was in a wheelchair. And the nurse was like, "Stand up there, go to the chair." Yeah, like you had the strength to have sex, but then you cannot stand up from the chair. Like all those insults. Like the public hospital is crazy. And then after that,
And you think
that
that's because
certain
they're exhausted
patient, yeah.
and-
No, I feel like they kind of judged that patient
Okay.
because she was young. I think she was like 18, 19. She was pregnant. And then They were supposed to give her an IV insertion, right?
Right.
And then she was like complaining, ouch, it hurts. And then she had a big ass tattoo on her back. So they had another. You have a tattoo on your back and you cannot even handle an IV? So I swear to God. There was his mother complaining. She was in pain. I was also a student that time. I was helping the mother out. She was complaining. And because there were literally like 2, 3 nurses in the labor room, and like a lot of them are helping with the other patients, they didn't mind her. I kept telling the nurse like, "Yo, she said she's in pain and all that. That's nothing." There's like to them, it's like it's nothing. But when I look at her diaper, the baby's head is already outside. I'm like, shit, we have to bring her to the delivery room. So we did. It's crazy, right? Those are my experiences.
That's a public hospital.
Yeah,
And how long have you been there that you have so many bad experiences?
I've only been there for like 2 weeks. For real. Yeah.
That sounds like experience from 2 years up there. Been 3 years there.
No,
What
it's
you're
only
describing,
two
it sounds like
weeks.
2, 3
Two
years.
weeks, yeah. Because like we are always rotated as student nurses. We don't stay in one hospital.
It's really
we
fucking scary. I'm not kidding. That's really
I know.
scary.
I'm sorry for laughing, but yeah, that was my experience.
I mean, every
For
time
the
that
public.
I hear, every fucking time that I hear about Filipinos living Filipino classic life, like public hospitals, public transportation.
Have you spoke to others about it?
Of course, a lot. Every time that I hear about public things, I'm thinking like it's impossible to live in this country without being rich. It's fucking possible.
That's actually true.
It's impossible.
Because
Not
even
rich, 50K, 60K.
no,
It's
even
impossible.
if a person is dying and he doesn't have money to give down, you will not be treated.
That's what I heard. Yeah, I have a good friend where her mother became sick, and I
Mm-hmm.
asked her, okay, so what do you do? She said, I have nothing to
Just
do.
die.
Let her die.
DNR.
Yeah, there's nothing to do. Just let her die in the house. They cannot even send her to the hospital to die
Yeah.
there like a normal person.
Yeah.
Not
Oh,
even
I've
sick.
actually had an experience where I was still a student. And then there was this family, although the patient was in DNR, which is do not resuscitate.
Yeah, yeah.
So the family didn't really have money and all that. So even comfort measures they cannot provide. The patient was screaming, crying, in pain, but no money, so they cannot prescribe pain medications. The patient was jaundiced, and then the patient was still alive. But then the next day, I did not experience the patient dying. No, the next day, the patient was gone, and I'm like, oh my gosh, this is what I have to deal with through my whole life.
So scary.
Yeah, it's really sad, but then you get used to it.
But you get just cynical.
Huh?
You get cynical towards it.
I don't know, cause
I think that's what happened to
I
the
don't know
nurses.
if I
They just
have
get
another
sarcastic.
experience towards the same situation where I create that certain relationship with the patient, which is what we nurses should always avoid.
Right.
But then in the OR, there are less cases of patients dying, but it's still possible
Of course.
because we have anesthesiologists, we have ventilators, and all
You're not
that.
emergency room.
Yeah, but in the ER, that's where a lot
course.
of people die.
Of course. And that's everything. That's for sure.
You can see a patient just hurting in pain, having chest pains and all that, but then they'll be treated, they'll be okay. But then in a span of a minute or two, they're dead. A lot of doctors and nurses are already lining up to give CPR. It's really crazy.
The one thing that I cannot even imagine how does it feel like. It's like let's say right now I'm thinking about a regular person, okay, a Filipino that makes I don't know even 12K, 15K, 20K, like regular money, nothing crazy, nothing too small, not like carbon people, like really really poor, not like that poor.
Yeah.
Just a regular person, right? Like someone like you.
Yeah.
Right? Without your parents' help. Let's say that your parents didn't have money, they didn't have the chicken
Yeah,
farm
yeah.
that they have. Let's say they have no money whatsoever. They're regular people as well.
Mm-hmm.
God forbid, knock on wood, that your daughter gets sick or your parents get sick.
Yeah.
It's just impossible. to take
Even
care
if you think about, even if my daughter does not get sick, and I'm working as a nurse, right?
Yeah.
Who would take care of my kid if I'm receiving 20K? Would I have money to pay a maid? If I'm
So
single.
scary.
If you think about it, right?
But that's just inconvenient. What I'm saying is, let's say she gets sick, God forbid.
Yeah.
What would you do?
Like, it's even worse if she gets
Like
sick.
Dangi. What would you do?
I would ask help from people, of course. My family members. Still, we're still gonna end up with family members.
Yeah, there's no choice. But a lot of
Yeah.
Filipinos that I know
Or
have no
loan.
relatives that make money.
I don't really know how the loan thing works because I've never tried, but
Usually
I
take
believe
from
you can
from
ask.
shark loan, from loan sharks. Usually take from shark loans that they give him like huge percentage, like 5% a month. They kill them in the percentage. They kill him in
Yeah,
interest.
yeah, yeah, I get that. But I've never experienced doing loans and I'm scared of it. I don't even have a credit card.
That's good.
Yeah, I guess so.
Yeah, I don't.
So I'd rather not spend. I want to make money too.
So the number one thing again comes back to the same idea, just salaries and understaffing.
Understaffed,
But you
salary.
think those nurses, like when you talk to them in person, let's say the public nurses, are they nice women?
No.
No.
No, that's a big no.
No, just not nice
Even in
women.
private.
Even in private.
Like, I work in the operating
Just
room.
marites and very
So-
chica women.
No, I don't think I have that type of relationship with them. But
Okay.
you know, there are other people who like to fake it and try to be friends.
Yeah.
But I'm not the type of person just so I can get a person's. I don't like to be friends with you, but I am decent. I will talk to you. I will
Of
do
course,
my
you're
job.
polite.
That's what I have to do. But I'm not trying to fake like, yo, let's be friends and all that. And when you see, because these nurses in the floor or the stations, they're so exhausted. Because imagine carrying how many patients, and then you get a call from an ER, from the ER, yo, we have another patient here. Can you admit this patient, this and that? And then it's really exhausting, like being a charge nurse in the floor. And us, we have to call. You know what's crazy? Because supposedly patients are only to stay in the recovery room for 2 hours, and we have to call the anesthesiologist. Like, vital signs are good. The patient is okay. He can be brought back to the floor. But then there are instances where they cannot accept the patient because they're still doing this, doing that. They still have to give the patient medication. We cannot receive. So what happens is they all flock in the recovery room, and only one nurse is in the recovery room. Imagine if the floor nurse cannot receive my patient, I'm gonna have another patient coming in. And imagine you're just one, you have to deal with like 10 patients.
One after another. Jumping
Yeah,
from room
you
to
would
room.
want to go crazy.
You will go crazy.
Yeah, you have to give this patient this medication due for this time, and then this patient is complaining for pain. You're just one person. It's crazy. Sometimes
Check for us, Pele. Check for us the
ratio.
yeah. Check for us the ratio for patients in a hospital compared to the staff that takes care of them.
Issue.
Ratio.
It would actually depend.
RATIO ratio.
Or
Issue.
Ratio.
TIO.
RATIO.
Okay.
so basically, it would depend on which station you are. In ICUs, it should only be 1:1 patient, 1:2.
Okay. And, is
And
that actually
for the floor?
The protocol is true? That's actually what
No,
happens?
they don't
No
follow
way, yeah?
that. Not at all.
No way.
No.
Like 1 to 10.
Yeah.
You say that's too much. Like too little.
What?
You think that's too little? Like 1 to 12 is not, doesn't make sense. It needs to be like
No, it's okay. It's actually okay for
Ah.
like nurses in the floor if they don't have critical patients.
Ah.
Yeah, because you just gotta administer medications. Because for the taking of the vital signs, which is usually done Q4 every 4 hours or Q hourly, it depends on the patient situation. It would be the nursing assistants what do you call that? Like, it would be the nursing assistant's task.
But I think that the data that ChatGPT gets is data that is really not something that we can rely on.
Yeah, but here I checked. It depends on the floor. For the ICU, it's 1:1. High acuity level 3 ICUs 1:2. Yeah,
Is that what it's supposed to be?
Depends.
Is that what it actually is?
for ICU alone.
No, but is that what it's supposed to be?
It's
or what
supposed
it
to
actually
be.
is?
Not actually is,
Ah,
because
what's supposed to be?
sometimes
That's a
yeah.
protocol.
If the ICU is too full, because in the ICU they don't accept patients anymore unless it's like really emergency situations where they can never say no.
Hmm.
Sometimes one nurse could handle like 3 patients.
Wow, an emergency.
Yeah. in ICU, which is like really critical
Of course, every
patients,
second
the
counts.
ones that are under mechanical
Yeah,
ventilation.
it's every second counts. Like every second can be death.
Yeah.
So, by the way, about emergency, because I know in the US how it works, a little bit at least. If let's say right now, God forbid, I get a heart attack, and I have no money, I'm a poor guy, not super poor, but regular person, as we said, 20K a month. I get a heart attack.
Yeah.
I need to be rushed into the hospital.
Yeah.
Because otherwise I'm gonna die.
Yeah.
They're gonna take me, or they're gonna
They're
tell me you
gonna
need to
take
pay.
you and then do something to like, what do you call that? Um, do the things to help you save your life.
Okay.
But
Does
then
it take-
after that, if you do have other complications and you don't get to pay for that, you don't. They won't.
Let me get this straight. Right now, I get a heart attack.
If it's in emergency cases, they're of course they're gonna attend to you.
Okay, no, but I'm trying to explain like further. Let's say right now I'm a person who makes 20K a month, 50K a month. I get a heart attack.
Yeah.
I've been sent to the hospital. They try to save my life. They save my life, and everything is okay. From that moment on, every second that I'm in the hospital, after I'm already in a stable state, if I want to be checked upon, make sure that everything is okay with me, money.
Yeah, you need money for that.
And if I don't have, they send me home.
Yeah.
And if I get another
But
heart
if
attack,
it's an emergency case, like
but
what
if I
you
get another
mentioned.
heart attack at home, do they send me again, or they tell me, listen, you're getting too many heart attacks for some?
No, they still attend to you, of course.
Okay. So in life, in that
But
situation,
there's
money
no
doesn't
like
count.
aftercare if you don't have money. But in emergency cases, of course, they're gonna attend to you.
Okay.
But then you're gonna end up getting a lot
But
of
how
bills,
quick?
bills,
How
bills.
quick is the ER?
How weak?
How quick?
How quick? They usually
In public
respond right
hospitals.
away, but then ERs are connected to other hospitals also because you cannot accept all the patients. So
That's
there are
right.
times where you know how we only have numbers of beds in the ER.
Exactly,
I
that's what I'm
believe.
asking. Like, can there be a case right now where one Oasis? What's the closest hospital here?
Mm-hmm.
What's the closest hospital here?
The closest hospital here, I believe, is there's strong weather in Mandawi Park Mall.
Okay.
There's
let's
also
see.
UC.
Doesn't matter. That's a UC.
Yeah. If you're already there, they're gonna take care of you.
Okay, okay.
But like when they connect to the others, they're gonna call like the emergency
The
team,
ambulance
right?
already knows where to
Yeah,
go.
they're gonna call the emergency team are gonna call you. We have a patient here who has suffering heart attack,
Okay.
and they
Where
can
can
say
they go?
like, oh, we have a lot of patients here. We cannot.
Yeah,
But if
yeah.
it's like really rush, like
Like
the ambulance would just take you there,
Yeah, like the closest
then
thing.
they
is-
cannot say no
Okay,
to that.
okay.
You can never say no to emergency
And the day after,
situations.
after I'm already stable, pay money.
Mm-hmm.
How much?
Yeah.
Like 500 a night.
I
600 a
don't
night?
know. I'm not so
Did you
familiar
ever have
about
a
that.
case where someone came to an ER and you just couldn't take care of him because he has no money?
No, I
Like
haven't.
afterwards?
I've only been in the ER for a month, but we haven't. But there was a case where a patient was rushed in because of alcohol intoxication.
Mm-hmm.
That guy had a huge amount of
Which is
alcohol
quite
in
common
his
in the Philippines.
system. Yeah, of
Yeah.
course,
You
Filipinos
guys
like
love
to
drinking.
drink.
Like the taga.
They
yeah.
love to drink. But then that patient, he was sober already because he was showing symptoms of like mania, doing this, doing that. And then he was sober already. He was given medications and all that. But the thing is, the hospital has to cater to a lot of patients, right? To
Right.
other patients.
Right.
But then that certain patient does not have money
Nothing.
at all.
Okay.
And
Like Red
like
Horse.
he
Red Horse and Tanduay.
yeah, Tanduay Kulafu drunk.
Yeah, Kulafu.
That guy had no money, and then under PhilHealth, they do not have that.
PhilHealth is the public. It's the public health of the Philippines.
Yeah, it's like
The public insurance.
insurance. Yeah, so they don't have it under PhilHealth where they can help patients who have alcohol intoxication.
Why? Because it's their own fault.
Yeah, because it's on their own fault. It's not like just like cosmetic surgeries. Why would PhilHealth help with that?
But
Right, cosmetic
it's
surgeries.
alcoholic intoxicated. What do you mean it's his fault? It's not the same.
Yeah, but then it's not under the list
So
of.
what if a fat
PhilHealth.
person gets a heart
So,
attack? It's his fault.
a fat person gets a heart attack. I mean, yeah,
It is his fault.
yeah. I'm not the one who makes the rules for PhilHealth, But yeah, it wasn't part of the PhilHealth like help. They couldn't help with that. So the guy was stuck there for like a week because he doesn't have money, even if he was fine.
A week.
Yeah, and then like the hospital bill keeps rising and rising and rising because he couldn't pay. He couldn't be discharged because he didn't have money.
Wait. So they brought him there. They took care of him. Then they put him there for a week. They locked him there because he doesn't have the money to pay for the bill.
Yeah, you cannot get discharged if you cannot pay.
And then what happened?
He was able to find help, but it took like a week.
How much did they
He
need to
was
pay?
okay for like 2 days already.
How much did they need to pay?
I don't remember.
And what will happen if you cannot get help? You just
Oh,
pay?
actually, like in the ER, there's a lot of really crazy experiences.
And every day that he's there, they keep charging him more and more.
Yeah. So like you'd be charged even just for IVs, splints, and all that. It's expensive. It keeps rising up and up.
Check
And
for us. How much money does it cost to stay one night in a public hospital in the
3.5.
Public hospital.
3.5.
No, in our hospital, that guy has to
No, I
pay
know- I know
3.5
what-
for a
3.5.
day. 3.5 for a day.
That's a private hospital, or that's in the one you had?
Mine. Well,
Well, I want to check in a public hospital.
okay.
Yeah, check in
There-
in a public hospital. How much does it take to stay in ER, emergency room? ER.
Oh, there's a lot of crazy
One night.
experiences.
One night. Okay.
Crazy experiences in the ER.
It's fucking
There was
insane.
even this white dude who was there. He was so big, and then I think he wanted to get out. He doesn't want care, but he needs to pay. I think he's broke as hell. And then after that, this guy, he couldn't run or he couldn't walk properly. He has a walker, right? Like that.
Yeah, stick.
Yeah, the electric.
Yeah.
Yeah, electric. What do you call that? Stretcher? No, not stretcher. The wheelchair. Wheelchair.
Wheelchair. Okay.
Yeah,
Really like
This
okay.
guy, he's so big, and then he tried to run out of the hospital,
'Cause he has no bill.
and yeah, he has no money to pay the bill. Yeah, he tried to run out of the hospital. The guards were
Yeah.
Okay. For one night, it's 2,500, and if you want to extend one more, it's up. It's beginning at 1,500 to 3,500.
It's fucking crazy.
yeah, so similar to
So
our
if you make
civil
20K a month, 4 days in the year, that's 10K. Half
Bye
of your month.
bye.
That's it. Finished.
Yeah, you gotta have
that can ruin a
savings
person's
though.
Life. That can be a loan that will take care of you for the rest of your life, just because of that.
Mm-hmm. You can opt to have a loan, but still, if you get 20K, it's really hard. How can you save off 20K?
Cannot.
How can you pay a loan?
Cannot. That's what I'm saying. That's it. It's a loan that will take you for the rest of your life because
Yeah, that's
10K.
how it is here in the Philippines. It's really hard. In the medical field, you can't. Not everyone can be catered to.
Have you seen cases of people coming to you and telling you like if you're not gonna take care of this person, it's gonna die? Happened to you?
No. I haven't. Like declining care. No,
Okay. Your friends?
my friends.
Yeah.
I don't know. I don't think so, but I've heard there are cases where the hospital cannot accept that because he doesn't have money. The surgery can't go on because he cannot down. Like sometimes we do have emergency surgeries, right? And then we scheduled for that patient, but then it takes time. Like they say the schedule the scheduled case can be cancelled if the patient doesn't just down payment.
Just
So,
decline
yeah.
treatment.
Yeah. So if they cannot down for the surgery, then they'll die, or maybe they can go somewhere else, ask for help. Yeah, they have to do that.
And that's also in public hospitals.
More.
Even more there.
I'm talking
even more
about my
strict.
private, semi-private hospital. So the more in public hospitals.
The more, like more strict.
Yeah. They're catering to a lot of patients. But in public hospitals, they have a lot of like support systems like malasakit.
Okay,
How
they
the
try
thing,
to
yeah.
help somehow.
They try to help some out. But yeah, in the private,
So on the
it
bottom
was how
line,
it.
don't
This is
be
based on
poor.
my experience.
On the bottom line, don't be poor in the Philippines, and if you are poor in the Philippines, don't get sick. That's the bottom line.
Yeah. But how can you be healthy when you don't even have
exactly,
money
yeah,
to?
Right? It's a will. How can you be healthy when you don't have money to buy
Yeah.
normal food, and how can you be
You can't
can you make
even
money
you can't
when
even
don't have money?
exercise. Like You can do walking, but you're too busy because you have to study, you have to work. Most Filipinos are like really hardworking. They don't have time to take care of themselves. Most common surgery are
Most common surgery, what?
Most common surgery are laparoscopic cholecystectomy is when there's stone formations in the
What is
patient's
stone formation?
gallbladder or bile due to unhealthy diets. That's what
Really?
I'm talking about where pancit canton
That's the
comes.
most common surgery in the Philippines.
Yeah.
Check for us. What's the most common surgery in the Philippines?
Most what?
Most
Common.
common surgery.
Comments?
Common. COMMON.
I don't know, but based on my experience, that's were many surgeries.
That's insane.
Yeah.
Most common what?
Surgery.
Surgery?
See? Appendectomies, cholecystectomies, laparoscopic cholecystectomy.
That's the one you said.
Yeah, it's where the gallbladder is removed
Because of bad diet.
stone formation. Stone formation is usually caused of increased sodium,
Too much salt, right?
too much salt, too much fat, fat
Iodized
buildup.
salt, right?
So
Too much
there's
fat.
basically different types of stones. There's auxiliaric, something like that, if I can remember.
Do you know in percentage?
So
Huh?
One is
appendectomy.
Chomot mo.
It's appendectomy, cholecystectomy, and hernia repair.
Okay.
Appendectomy is the one where they have to remove
The one you
the
said, yeah.
appendix. So I mentioned it earlier, right?
Ah,
Where
okay,
there's
that's only
that
the
cases,
appendix.
yeah.
What is this cost from?
Um, fecal matter that is stuck in the appendix. Basically, appendix, the organ that doesn't really have much function.
Okay.
But then
But if it gets
it's part of
removed-
your GI system. But there are times where poo gets
Okay.
stuck, which is they call the fecalith. It gets stuck in the appendix, and that's where it causes pain.
But what does it cost from? Does it cost also from bad diet or what?
Not
Genetics?
basically, not
Okay.
basically. It just happens
Okay,
at
okay,
times.
okay.
That's why sometimes you cannot avoid it.
Alright. And the second thing?
And then the second, which is cholecystectomy, which
Yeah.
is what I mentioned earlier. It's because of unhealthy diet and all
And the
that.
third one was what?
It was hernia repair.
Yeah.
Hernia repair is when there's like a bulge in your stomach because the what do you call that? The intestine came out.
Okay.
Because there are different types of hernias. It could be in your abdomen. It could also be
That's
inguinal
caused by-
hernia, like a part of your stomach came out to your near close to your vagina or your
Okay.
penis. Yeah.
What is it cost
So
from?
what you call the inguinal hernia.
I know what it is. It's the bulge where you get when you
Yeah.
lift heavy weights, right?
Yeah.
Yeah,
It
so
could
like if
also
you
be
lift
caused by heavy
wrongly-
weights.
Okay.
Yeah.
So that's not considered with diet. Okay.
So those are the common ones, but mostly the appendectomy and cholecystectomy. That's what I've
That's
experienced.
insane that the most common surgery in the Philippines is caused because of bad diet.
Bad diet, yeah. Filipinos like to drink soft drinks. They like to eat
I don't know
pancit
if it's only a matter of
canton.
culture-wise. I think it's also a matter of money, as you said. You know, if you
Yeah,
have no money
like
for
pancit
anything else.
canton is cheap. Pancit canton is only 13 pesos, I
That's
believe.
insane.
And then you get a lot of sodium. So you build up all those salt in your body. It's gonna be stuck in your fat.
Have you ever seen one like that?
What?
Like a person going through this kind of surgery? Have you ever been in a surgery?
Oh, yes, a lot of times.
How
It's
does
like
it
the
look like?
common. You want me to show you a
Sure.
stone? Wait.
Let's see a stone for a person who ate bad.
So there are different types of stone. There can be a stone that is like small. There are bigger
sure.
ones. Wait.
Is it like the kidney stones or it's different?
Kidney stones is different. Kidney stones are in your kidneys.
Yeah.
But gallbladder is yeah, but it's also basically because of the same thing.
I
It's
thought
because
kidney
of
stones are in
diet.
your lungs.
No.
I'm joking.
Wait, stone.
Can you hear what she said? The most
Yeah.
common surgery in the Philippines is caused because of bad diet.
It's under the.
No, but it's caused because of bad diet.
Health.
The biggest surgery in the Philippines is caused by bad diet. That's why they have. It's fucking insane. Is it fail? Like if you don't take care of it, can you die?
Yeah, it's so painful.
Shit.
Yeah, kidney stones are painful, but also
not kidney
gallbladder
stones.
stone.
Yeah,
No, gallbladder stones are also painful.
Can you die
Imagine
from it
something piercing.
besides inconvenience?
It's not super fatal, but you can die not because of the stone, but you can die because of the pain.
Really?
Wow.
Is that painful?
Yeah. That's why they get surgeries for it, because if not, then you could just leave it there.
How much does it cost? Check for us.
Uh,
Check for us. How much does it cost?
I'm trying to look for the stone.
Because that's funny, because mostly the people that are gonna do it are probably poor people, because usually rich people eat healthier because they have the money and they have
What
the
is the
knowledge.
name of the solution?
Cholecystectomy.
They just copied the one that looks like one.
I'll be looking.
Tell us how much does it cost in a public hospital. Give us a range.
You can keep asking while I'm looking for the video. The
It's between
excuse me.
public
Yeah.
public hospital.
Yeah.
It's between 12,000 to 20,000
Pesos.
Yes, pesos.
Okay, so $200, $300.
Yeah, but in private, it's a lot of.
How much?
It can be up to 150,000 pesos.
No way.
It's crazy.
Yeah.
Wow. But check, because I'm sure it's gonna be crazy also. How long from the time that you make the appointment, like how long will it take go in a public hospital to get an appointment like that? Because it sounds like a difficult surgery that happens a lot. So I wonder how long will you have to wait for it? What's the waiting list? How long does it take the surgery?
In public, it's
The surgery alone,
Yeah.
it depends on the case. Some surgery can only last for laparoscopic, it will last for 30 minutes. Depends on the doctor.
So it's not that
but
complex.
sometimes it's lasts for 2-3 hours.
But still, it's
3
not
hours.
too crazy.
It's not that crazy.
If
2
it's
to 3 hours
emergency,
is long.
a few hours up to day one good day. If it's if you make
Schedule
an
it?
appointment, so it's between 2 weeks to 3 months.
Okay.
In public,
Yeah.
hospital, but in private, it's 3 to 10
Yeah,
days.
public makes it up.
Yeah.
Okay.
10 days. But it's expensive.
Yeah, very expensive. No, but private hospitals are always expensive, everywhere in the world. But even like I'm thinking, even for a Filipino that makes 20K a month,
Here
12K
you
is a
go.
lot of money.
This is big actually. You cannot compare it, but that's someone's stone inside a
fucking
gallbladder.
way.
A gallbladder is so small, like this small.
Stone?
No fucking way this was in a person's body.
Yeah. I told you that's like mix up of a lot of sodium, calcium.
It looks like an asteroid.
Yeah.
You have, wow, you can see the blood even.
Show
Look at
it.
the camera.
It really looks like a fucking alien. With a lot of fibers inside. I don't kid it. Wow. That's the scariest shit I've ever seen in my life. Holy fuck.
Can you show that to the camera?
You have to show it to the camera. You have to look at this.
If you want to see it,
Look at this. That's the scariest shit I've seen in my life.
See how clear it is in camera.
That's so fucking scary.
scary.
Yeah.
It's inside you.
How big is the thing? How big is the bladder itself?
Huh?
How big is the bladder? Like the thing that is in, no shit.
Yeah.
So this thing was fitted in this.
Yeah.
Yo.
The average kidney is this small, but when they have tumors around the kidney, it goes big. I also have a picture. Wait.
Yo, so scary. Is that relatively big or is that normal?
Huh?
Is that relatively big stone?
It's
or
so
is-
big, Gui.
Ah, okay, it's big. Okay.
Because there are stones like this small.
Okay.
So it depends. I think there's like strovite stones. There are different types of stones.
How can a person live with this in his body? How can he not die?
There are even what do you call that?
That looks like a
Females
stone
that
can throw at
have
someone's head to kill
very big tumors where it's so big, like their tummy becomes this big, and then we have to bring it fluid filled. Sometimes mostly it's fluid filled. Sometimes we have to bring it to the laboratory. This is what I'm saying. It's so exhausting. We have to carry the specimen from the operating room to the laboratory, which is far. Imagine like carrying 30 kg so far. Like it can be that heavy. Imagine a girl carrying that big
Sounds like
ass
a good
tumor
training.
for like 30. Huh?
Sounds like a good training. Do
Training, yeah, but I don't want to train like that.
Good
I'm not
training,
comfortable. I'm not comfortable
carrying a
shoes
tumor.
and all that shit.
Sounds like a good training. No good day in the gym carrying a tumor.
Yeah. Here
No,
are
it's
some
Khov
of my.
Gidul.
This guy under motor vehicular accident. They have to repair the face. Wait. They had to remove all the scarring.
Wow, poor guy.
We even had experience where there was a patient under MVA, and then he was crushed under a car, and then his what do you call that? His spinal cord was showing already. I mean, it's a great experience being in the operating room.
Shit. Oh my god, look at his lip.
Yeah, it's like stretched out, right?
Shit stretched out. No, that's too scary already. That's not for me.
You decide for.
That's okay.
So it's a great experience being in the operating room because I myself am interested in those stuff. I like stuff out of the ordinary.
Yeah, you like those things?
Yeah, it's just that it's exhausting. Like all the other, so I'm not complaining about my job. I'm complaining about the people running
But
it.
besides the money and the facilities, did you feel the fulfillment of working in a medical field? You
Bro,
felt like you're
like
helping people, yeah?
if everything was okay, like we have
money-wise
a
and facilities-wise?
problem just looking for BP cuffs because most of it are broken. Like
What is
you
BP
want to
cuffs?
focus on
What
this.
is BP cuffs?
A BP cuff is the blood pressure cuff where
Okay, okay.
you have to monitor the patient's vital signs every 15
rubber,
minutes.
yeah?
Yeah.
You had not enough rubbers.
No, not enough because they're using it all in the OR. Like I told you, right? The machines,
But it
machines
costs
are
like 20
saying
peso
error.
apiece, right? Like
Huh?
20 peso, 15
No,
peso.
sometimes the wires would cost you 100,000 pesos.
For one?
Yeah, wiring alone. That's why we have to really take care of the hospital.
How? Wait.
Hos-
The cuff itself?
no, not the cuff.
Oh.
Like the wirings. I believe like the cuff they use are connected to the.
Okay, they're
yeah.
connected
So
to
it's
it,
not
okay.
it's not as cheap as the ones you just buy as
Yeah, yeah.
Because I'm only one nurse dealing with a lot of patients in the recovery room. Of
Right.
course, I cannot do BP here, BP
Yeah.
there, BP everywhere, and then it depends on the patient's condition. Sometimes it's not every 15 minutes. Sometimes you have to um, check the BP every 10 minutes, and it's really hard. You're just one person, and then you're running from this patient to that.
But when you're talking about this now, do you miss going back to being a nurse? If the pay was good and everything, would you go back?
If the pay was good, of course I would go through all that stress.
You go back.
Why not? I love my job, I'm not gonna lie. And also, if they made everything better, like, we won't have a problem with transporting the specimens. They could have at least the one person who transports the specimens. Yeah, all at once because they were gonna soak it in formalin. But their what do you call that? Their opinion on that is because we are the nurse of that certain patient. We
So you're the
know
one who needs to take
that certain specimen, but no, we don't know anything about the specimen. That's why we're sending it to the lab so that it can be studied.
No, that's just an excuse. Yeah.
Yeah, why can't they just have someone else to bring the specimen to the lab?
Motmot.
It's really stressful. I'm not gonna lie, but
Motmot, in case
I
there's
love my job.
a young Filipina or
Yeah.
Filipino that is watching us right now and got all the way here, and they want to know, would you recommend them to be a nurse or not? Is it something that they should pursue? If they shouldn't pursue it, why not? If they should, why will they? Give them some advice about that. Something practical.
If you love it and if you have a strong heart, because you're not only gonna be dealing with all those bloody stuff, you're also gonna be dealing with patients who are tired, exhausted, dealing with money, not only physically, but you have to deal with the patients emotionally. So it's a really exhausting job. But I believe, like, I don't know right now because, you know, in other countries, they're still looking forward to nurses until now. But then Trump is making it hard. So you can go to other countries like UK, but it's not an easy process. It's not like everything is written down for you. You always have to find ways. But if you love it, if you're interested in helping people out, or me, I'm different because I'm interested because it's out of the ordinary.
Right.
I don't like doing things that simple people can do. I don't know if I'm saying the right thing.
Alright, makes
It's just that I'm interested into how this thing works, how surgery works, like dealing with people's life and all that. Yeah, I'm
So
different.
if
So I'm
someone is interested
interested
in
in
it,
it.
you will say go
Yeah,
for it.
because my brother, he is actually forced to do nursing.
Really,
He took like how many years in nursing school, but never. He
nothing.
until now he stopped. Because he really wanted to do IT, but my parents were like, "Oh, this is a better plan for you." This and that, but he can't. Imagine before we were eating, right? And I was like, I saw something interesting. I showed my brother, like, "Yo, this is how they do a breast surgery." Like, what the fuck? He stood up and then he stopped eating. He put the food in the washing place. I'm like, oh, I didn't know how other people would think
Wow.
of it this way.
So we didn't
So he
really
was
wanna.
disgusted,
Yeah.
yeah. And there are also other certain students. I've heard the story. I've never experienced it. Who they were in the delivery room, and there's this one student who was looking at the surgery, and what they're doing in the girl's vagina, delivering a baby. Oh, this kid passed out. There are certain instances like they pass out because they
Okay,
see
so
blood.
if you're not a happy if you're not a
Yeah,
weak
you have
heart,
to be strong
yeah,
to
if you're
be
not a
an
weak heart and you can see those things and you like it, you say
Yeah.
even though the pay is shit and everything,
Yeah.
still pursue it because it's something that fulfills you.
Yeah, but for me,
So you don't
I'm not
regret that.
scared of those things, so I don't have to be strong in terms of that. But like dealing with people, you're not only dealing with patients, you're also dealing with doctors and co-workers, which is the hardest part about it.
Really?
Yeah.
Why?
Some doctors are nice, but when you meet doctors from older doctors, they really have that attitude.
Like I'm a doctor.
I hope the doctors don't see this.
Yeah, I'm the
But yeah,
the
in the
delicate genius.
operating room, oh, I swear, when you give them the wrong instrument, like hand them the wrong instrument, they will throw it at you.
Really?
Yeah.
You know what it reminds me? You've seen you know Seinfeld, the show Seinfeld,
No?
the comedy show from the 90s.
Uh huh.
There's this guy. Their name is George Costanza. He's a very short, fat guy. You know it?
No, why is he laughing?
You know Seinfeld?
Of
You've
course.
seen it?
I've seen it.
Yeah. There's
Yeah,
one
I'ma
case.
check it out.
There's one case in Seinfeld that he needs a surgery. I don't remember what it was, but he needs something. He needs some operational thing. It's like Friends, but much funnier. Seinfeld. And he went to the doctor, which was a doctor who was a friend of a friend. Okay?
Uh huh.
So we went there and said, listen, I need to get this surgery done. I need you to take care of me, make me a good price because you're a friend, blah, blah, blah. She said, sure, no worries. Or, okay. A few hours before, he called her, listen, I cannot go because my mother fell down in the bathtub. She broke her hip. I need to take her to the hospital. I'm not going to be able to get there. She said, no worries, of course. Next day he came. He said, okay, I'm ready to have my surgery. She said, of course, it's 170 for yesterday and 170 for today. And then was like, what do you mean 170 for yesterday? But I called you. I said I cannot come. She said, our procedure is that you have to notify 24 hours before. And then he started screaming in the room for like 2 minutes. The delicate genius! The delicate genius cannot have a room for 24 hours. The delicate genius!
Oh
I'm
my
so sorry, the
God.
delicate genius. Yeah,
I'm gonna check that movie.
the delicate
out.
genius.
The delicate
the
genius.
delicate genius, right? The doctor.
Crazy.
Yeah.
But yeah, that's true. If you're
Don't
like
interrupt them, the delicate
scheduled
genius.
for a surgery and it doesn't go on, of course it's gonna take time. Like the other surgery is gonna push through because of your scheduled surgery. So
'cause you're
you're
very-
gonna be, you have to pay the operating room for that.
Yeah. So your advice will say, yeah, go for it. You
Go
don't
for
regret
it.
your 1 year after.
If you enjoy it, if you're interested like me, I like watching weird stuff, surgeries, then go for it. Yeah.
And you don't regret your 1 year doing it yourself.
I don't regret it in a way, but I wish they could have done it better, yeah.
Sure. Okay. What?
Yes, sir.
Thanks, sir. Oh my god, I became a sir now. Thank you for your time. It's really been a pleasure.
No problem.
I hope you
Anytime.
I cannot wait to stay.
We're gonna have other podcasts too,
For sure.
aside from
You like
nursing.
You like it?
Yeah, it's
Yeah?
fun.
Next time maybe we can talk about your.
What? No, what?
I don't know if I can say it on camera. I'll keep it to myself.
Just don't say it.
I'll keep it to myself. Talk about other things. I cannot wait to taste your food, Motmot. You need to make us food.
Yes, I love cooking too.
You need to make us food. You need to come to our place to Stay City.
Sure.
Yeah, you should come.
I'm gonna cook some good food.
For sure. I'll make you cocktails. You like cocktails? I make cocktails.
Is there
tomorrow.
alcohol in it?
That's the idea of a cocktail.
I don't like alcohol.
What? Okay. We'll keep it like that.
You can
Mom
make
doesn't
juice,
like
it's
alcohol.
fine.
I make her juice. I'll make you a mocktail.
Okay, you see? Mocktail is better.
Yeah. For the virgins.
Or coffee. Coffee
You're
is
a
good.
virgin, Motmot?
I'm a virgin, I have a kid.
That's nice. Maria. Yeah. Like Maria the Virgin.
Maria, yeah, the Virgin.
But your Jesus was black, right?
Can you stop?
Okay. No, thanks a lot for being here. Really, it's been a pleasure.
No problem.
And maybe soon
Next
we'll talk to
time.
you again. Yeah, for sure. We should.